All right, so in this video, we're going to talk about sacral flexion. So when do we need sacral flexion, right? Well, if we're slump sitting, which I do not advise, the sacrum needs to be able to flex. But also anytime the hip moves into a flexed position, ultimately, after we run out of hip mobility, the pelvis or the innominate needs to be able to flex. And then once we run out of innominate mobility, the sacrum needs to be able to flex, okay? And then it actually translates up into the lumbar spine. So let's say we've cleared the hip and now we want to know, does the sacrum flex? So to get on the sacrum, actually ideally you will be on the skin whenever you work on this. So she's going to allow me to get on her skin. Sorry, my hands are cold. And so if I feel the top of iliac crest, that's basically even with her umbilicus, that's L4, right? And so then I want to imagine L5 and then sacral base, okay? So I am going to come medial to the ASIS. I'm going to sink in, and you can bias if you want to be more right-sided, middle, or left-sided. I'm just going to try to bias kind of centrally on the sacrum, and I'll sink in and I will feel, can I find L5, okay? So as I sink in, L5 is hiding from me. But L5 is here, okay? And then as I drop down, I feel L5 disc there, okay? Because the disc basically is a little bit of a ridge, okay? And then as I drop below that, things start to drop down towards the table a little bit more. And if I sink in a little bit deeper, I am on the base of the sacrum, okay? So I have to use my body to sink in until I get somewhat of a bony backdrop to know that I'm on that sacrum right there, okay? Now I want to feel, as I take her hip up into flexion, at what point does that sacrum start moving? And it's right about right there. And then from there, I can kind of do a combined spring test where I'm taking the hip up a little bit higher and I'm also spring testing down into the sacrum just to see if there's a hard infill there, okay? If there is, I can mobilize just through this hip. So hold here, don't let me lift up your leg, and that engages my finger better into the sacrum. And let it go. Good, and I can work on flexion there. I could do double legs if I wanted to, bringing her up, and I could feel as I bring her up, that actually gives me a much better infill here, okay? And then I could kind of localize through her legs to see what gives me the hardest infill through my finger, okay? I could also, if I don't want to use, if I don't want to like have to arm both of her legs together, I can actually bring up the table here and put her feet here. And then once I get it up, I can sink back in onto that sacrum right there, okay? And then I could kind of feel at what point does the sacrum want to start moving, and it's about there, okay? And now from here, I can have her, I could localize through her knees, and I can have her engage her feet into the table. All right, now I'm not having to work nearly as hard. I'm just focusing on my treatment hand. All right, all of this is to help the sacrum flex when it needs to be able to flex, okay? Sacral flexion, give it a try, different variations. That's sacral flexion mobilization.